Welcome to SSKIN Care Plan training session. We would like to pay our respects to Aboriginal elders past, present and emerging, and extend that respect to all Aboriginal peoples. These are today's learning objectives. This new pressure injury care plan replaces the Waterloo and SSKIN tools across southwestern Sydney Local Health District. It has been designed to support clinical judgment, streamline and reduce documentation, and align with patient-centered care. The questions within this form are intended to be asked directly to the patient, or where appropriate, their family or carers, while always applying clinical judgment. This new care plan is designed to support evidence-based practice for pressure injury prevention and clinician workflows. It aligns with Standard 5 comprehensive care. It aligns with single digital patient record practice. The SSKIN outcomes and strategies can be documented within the comprehensive care plan in section named Other to facilitate continuity of care. You are required to complete this care plan within 8 hours of admission. If the patient is identified as at risk upon the initial screening, review and update the care plan daily. If the patient develops or has an existing pressure injury, review and update each shift. If the patient is not at risk and has no pressure injury, update only if there is a change in condition or mobility, postoperatively, at transition of care, if a pressure injury develops. For community and outpatients, complete SSKIN as per local policy. A malnutritional screen tool, MSD, is required to be completed once on admission and then weekly or when clinical indicated. However, not every day or shift for the high-risk patients review. Let's now take a look at the SSKIN and applying it to some patient scenarios. Emily is a 20-year-old student admitted with shortness of breath, observation stable, has a history of anxiety, independent with activities of daily living and mobility, eating and drinking. Emily has no medical, surgical or medication history. To access SSKIN Care Plan, use the patient summary page and select the document launcher. Then SSKIN is accessed by Nurse and Allied Health. Or you can also access SSKIN via Ad Hoc under Nursing Assessments folder, or under Emergency in FirstNet. This care plan is structured into 3 key sections. Top section, risk status, at risk or not at risk. If risk factors are present in the left column, the patient is considered at risk. Note: this field is not pre-populated and must be selected at the end of the assessment. Left column, patient risk factors. Following completion of an initial screening, risk factors may be pre-populated and must be reviewed and confirmed. Right column, corresponding interventions. Interventions appropriate for selected risk factors will appear when risk factors are selected. When risk factors are selected, interventions are enabled. If no risk factors are selected, interventions will appear grayed out. Bottom section, complete skin assessment and standard pressure injury prevention actions for all patients, including redness, blanching, or no visible injury. Each time you complete or update the form, all sections must be reviewed. Mandatory fields must be completed. Even if information is pre-populated, it must be confirmed or updated. Reference text is available next to some items. These provide definitions and guidance. Right-click on the field and select reference text. They link to supporting resources such as PDFs or booklets. Use these if you are unsure about terminology. Now let's walk through Emily's risk factors by assessing Emily's skin, sensation, and moisture. Then complete the risk assessment on the left column. There are no concerns identified. She independently mobilizes. There is no equipment or devices that is on her skin. She has no problems or concerns with sensation or circulation. She does not take any medications that pose risk to her skin integrity. Her skin is not exposed to moisture. The patient is continent. She can reposition independently. She is not bedbound, so interventions and education are not required. We have already completed malnutrition screening tool when we completed the adult admission assessment form, so we select not applicable. Now, let's consider the standard pressure injury prevention actions that should still be applied where appropriate. Encourage regular mobilization. Use emollients to maintain skin hydration. Complete and document a skin assessment on the right side with skin being intact. Based on this assessment, There are no identified risk factors. Return to the top risk status and indicate the patient is not at risk of developing a pressure injury. In this case, the care plan does not require routine daily updates. Only if change in condition or mobility becomes post-operative, transition of care or a pressure injury develops. Ensuring the care plan remains clinically relevant and responsive to any changes in the patient's condition. Sign off the form with a green tick. Refresh the screen. You can see the blue triangle next to SSKIN indicating a form has been completed. Now the SSKIN can be found in Results. In Continuous Doc. In Clinical Notes under Assessments folder. Form Browser. And Documentation. You are now meeting Jonathan, Jono, for the first time, transferred from emergency to the ward. Jono is a 50-year-old victim of a motorbike accident requiring an open reduction and internal fixation, ORIF, procedure, which has been delayed now as he has been taking warfarin. Jono has been placed in an interim cast, not causing him any discomfort. He mobilizes independently, without assistance using crutches, and is occasionally incontinent of urine. He likes to lie in bed, watching TV, reports pain is manageable. He has a significant medical and surgical history, including type 2 diabetes mellitus, and a number of medications, posing a skin integrity risk like metformin and prednisone. Now let's walk through Jono's risk factors. We go into Jono's patient chart and click SSKIN under the document launcher. At this stage, there's no current concerns, the skin is intact. There is no previous pressure injury. He has a cast against his skin, so we put yes. Now we consider the interventions. We select Initiate Skin and Barrier Protection, Initiate Skin Hygiene, Reposition device regularly if applicable. There is no problems or concerns with sensation or circulation. The patient is on metformin and prednisone, which can impact skin integrity and healing. His skin is exposed to moisture. He is incontinent. For interventions, we put Initiate Skin and Barrier Protection, Initiate Skin Hygiene, and Completed Incontinence section on FRAMP. He is able to mobilize independently. He is not bed-bound. For interventions, we select Encourage patient to self-reposition and heal offloading device, pillow or Prevalon boot, and reposition the patient every 3 hours. Jono has not had an MSD completed, so we would select Yes and complete the MSD. Patient has no risk factors with MSD. We provide patient and family education. We select Encourage mobilization, use emollients to maintain skin hydration, and use transfer aids to reduce friction shear. Jono's skin is intact with no signs of pressure injury. Return to the top risk status and indicate the patient is at risk of developing a pressure injury. Sign off the form and refresh. This form must be completed daily as the patient is at risk. Jono is finally cleared for surgery and has his cast removed on the morning of surgery. During your skin assessment, you notice a pressure injury on his right heel. Whilst many of Jono's risk factors remain the same, it is important that we review and update the care plan based on his current condition. Let's reassess the risk factors. Click on SSKIN under the document launcher. The patient now has current previous injury. He has now developed a current suspected deep pressure injury, so we consider offload area, document stage and location in clinical notes and wound eye view, take a clinical photo, if hospital acquired, complete actions as per district pressure injury policy, if hospital acquired, complete IMS+. Other risks are unchanged. Jono is unable to independently reposition, and is now bedbound and unable to leave the bed. Let's review the appropriate interventions on the right. We implement pressure-relieving mattress and pressure-relieving cushion for chair, and increase the frequency of repositioning Jono to 2 hourly. Consider a dietitian referral to support skin integrity and healing. We have already completed the MSD, so we select Not Applicable. We complete the standard pressure injury prevention actions skin assessment. Actions will include encourage mobilization, use emollients to support skin hydration, use transfer aids. Record the pressure injury assessment findings on the right. Record the stage, SDTI, and document the location of the injury. Note when documenting your skin assessment. Ensure you document specific characteristics of the skin, including redness, blanching response, any early signs of breakdown, and specified pressure injury. Now we go to patient risk status and choose patient at risk. Sign off the form and click refresh. Importantly, as the patient now has a pressure injury, the care plan must be completed and updated every shift to ensure timely monitoring, intervention, and prevention of further deterioration. Following the completion of SSKIN, it is essential to update key components of the comprehensive care plan, adding in relevant risks and strategies identified into other, LASO thinking about personal care, nutrition provision, and plans and goals for discharge. Resources can be found on your district digital health intranet page, and if you require assistance you can speak to your CNE, wound champion, call statewide service desk, log a SARA ticket for clinical support and training assistance or contact your local informatics. Thank you for your time.